Welcome to video number 2 of the 4 video series on colon cancer awareness. I hate colon cancer, so I have dedicated 4 videos this month to increase awareness about colon cancer. Last video was about symptoms of colon cancer, age to start screening for colon cancer, and what constitutes a family history of colon cancer. Today, we're going to focus on ways you can protect yourself to prevent colon cancer. So how do you protect yourself when you're not old enough to have a screening colonoscopy? Optimize your lifestyle. That is key. Eat healthy. Eat plenty of plants, which are high in fiber. Avoid alcoholic beverages. Stop smoking if you're smoking. Lose unwanted weight if you're overweight or obese. Start or continue a healthy exercise routine. Take symptoms seriously and discuss with your doctor if you have rectal bleeding, abdominal pain, or a change in the bowel habits. So what are the screening options? Well, there are multiple colon cancer screening options, including colonoscopy, CT colonography, and stool studies. Before choosing a modality, it is important to understand the pros and the cons. Colonoscopy is used to visually look through the colon and find polyps, which are thought to be precursors to cancer. A polyp is an abnormal growth inside the colon, which comes in many different shapes and sizes. Luckily, most polyps are slow growing. It is believed to take about 10 years for a small precancer polyp to grow into cancer. Colonoscopy is the gold standard method because it is both diagnostic and therapeutic. The polyps are identified and removed at the same time during the colonoscopy. It's covered under most insurance plans. If no polyps, you won't need another colonoscopy for 10 years. The cons include the need for anesthesia. You would have to take a day off of work and the need for a prep to prep the colon prior to the colonoscopy. Another screening method is CT colonography, which can visualize the colon looking for polyps. A small probe is inserted in the rectum and the colon is filled up with air. This modality does not require anesthesia, but it does include radiation exposure. It is tough to visualize very small polyps. You will still need to do a prep. It's uncomfortable because you're awake. If it's abnormal, you would have to repeat the entire prep and proceed with the colonoscopy afterwards. Another way to screen is via stool studies. Stool studies include the FIT test or the Cologuard test. You can collect a specimen at the convenience of your own home and mail it in. There's no need for bowel preparations, no need to take time out of work. Tests for advanced polyps and cancers, but not very reliable for early polyps that may turn into cancer. There's a false positive rate of about 10% for Cologuard and 25% for FIT test. It means that you may test positive, but you may not necessarily have cancer, which can be a little bit stressful. The Cologuard test is supposed to be repeated every 3 years and the FIT test yearly. So what is a Cologuard test? The Cologuard detects abnormal DNA and blood in the stool. This test is approved for average risk individuals, therefore not an option for people with symptoms such as abdominal pain, bleeding, or change in the bowel habits, people with a family history of colorectal cancer, history of polyps, and history of inflammatory bowel disease. The Cologuard is a good test to detect cancer. With the normal test, there is only a 0.06% chance that you have cancer. However, 1 in 10 people will have a positive test and then find out the stool test was wrong. Unfortunately, this can cause a lot of stress, and when you schedule a colonoscopy as a follow-up test, the colonoscopy may no longer be completely covered by the insurance company because it's no longer considered a screening test. Cologuard detects advanced polyps or cancers and does not detect small precancer polyps. What does a colonoscopy involve? You would see a gastroenterologist in consultation who determines whether you are a good candidate for the test. You would schedule the test at the time of the visit. The day prior to the actual colonoscopy, you would have to cleanse the colon by drinking a prep solution. If done properly, the colon gets totally cleaned out where there's no stool around. So the gastroenterologist can take a really good look around your colon. On the day of the procedure, while you're under anesthesia or sedation, a long flexible tube with a camera and a light source at the tip of it is inserted into the rectum. The images are reflected on a screen so the endoscopist can visualize the mucosa very carefully. The gastroenterologist who's performing the test looks carefully for polyps, which are abnormal growths. When a polyp is visualized, it is removed immediately at the time of the procedure. Colonoscopy is usually an outpatient test. Expect to be there about 2 hours, but the actual test is usually around 20 to 30 minutes. After the procedure, one would have to be driven back home where you should rest for the rest of the day. Thank you for listening to our second of 4 video series on colon cancer awareness. Stay tuned for the next video, which we will discuss the association between red meat and processed meat and colon cancer. #Dr. Angie Sadeghi, #colon cancer awareness.